Let's get to our next story. So, yesterday, of course, federal government announcing this new dental plan, which has been a long time talked about, but finally appears to be coming to fruition. It's going to be, of course, kicking in for seniors, although they picked a weird age.
87, right?
87. I don't get it. But anyway, they'll be the ones who have access to this first. But then there's the question, of course, of what this means if you live in Quebec, because we have our own situation here, our own dental plan. And again, every time something like this happens at a federal level, you know what happens in Quebec.
We want money.
Yeah, they look at the feds and go, hey, first of all, don't poke your nose into our business, and second of all, how much can we get?
Yeah.
So we thought we'd try to find out more. Dr. Michael Wiseman is a part-time associate professor in the Faculty of Dental Medicine at McGill, and he's got a private dental practice here in Montreal as well. He's on the line. Dr. Wiseman, thanks for being with us.
Thank you, Aaron. Thank you, Natasha.
Can I begin by asking, first of all, as someone who does this for a living, this plan is great news for people who can't afford a dentist. Does it automatically mean that every dentist is involved? How does that work from your understanding?
From my understanding, the dentists have to basically enroll into the program. They're not automatically covered by the program, so you have to enroll. So therefore, if Mr. Smith saw Dr. Smith, not related, of course, as doctor and patient relationship, doesn't mean that the doctor has to enroll in the program. It's totally up to the dentist to decide if he or she wants to become part of the program.
Is that the case right now? Because I know kids are covered up to a certain age. Like, what is the situation right now in terms of dental care in Quebec?
Well, kids are covered by RAMQ up to their 10th birthday for basically everything. But as we know, with the new program with the Canadian government that's come out with now, kids will be covered for associated other up to the age of 12. But there is some problems and some good things about this program. First of all, I'm excited because I think that many Quebecers, many elderly patients cannot afford their dental care because once they retire, they often lose their insurance plans, and therefore their oral care is negated. And there is a strong link between poor oral care, oral disease, and systemic disease. So trying to do this as an ounce of prevention is definitely worth a pound of cure in this part of the government's approach.
So my question here, as I said off the top, this is a federal program, this initiative. Mm-hmm. We kind of tend to operate under a different umbrella here. You just mentioned you're covered here, RAMQ, up to the age of 10 as a child. How much of what's in this federal program is necessarily even going to be adopted here?
I think it's all going to be adopted. I got some emails yesterday from the Ordre of Dentists, from the Association Chirurgiens de Québec, and they all seem to be very much in favor of the program. There are some questions out there as to, because they want to use their fee guide, not the Quebec fee guide, which is a guide that's been established to try to understand the expenses for a dentist in private practice, the effects of inflation, material costs, etc. These are all going to our fee guide to try to reduce the costs to the dentist and allow us to have a living, so to speak. But what I'm excited about is that this will help those patients who have been avoiding the dentist.
Right, simply because they couldn't afford it. Yeah, so I believe the household income has to be $90,000 and below. If someone falls into that category, but they have a plan through their work, would it still would go on the plan?
No.
I know. I'm sorry to ask all these. I know we don't know all the details.
Well, no. What I have read is that if you have your own insurance, you're not eligible for this plan at all. So if you're retired and you have your insurance from your old work, you are not able to enroll in this plan. However, you got to remember it's not all free. And the key thing here that people have to understand is that they can't just go into the dental office with their RAMQ card. Hey, I'm here. Fix my teeth. It's free. First of all, it's only free for those with no co-payments, rather, for those earning less than $70,000. Those between 70 and 79, almost 80,000 is 40%, and 80 to 90 is 60% of co-payment. So they got to pay their share of the cost. And it's not it's only really it's free for those under 70, but we're hoping that the patients will be able to afford their co-payments thereafterwards.
Okay, I want to, again, there's a lot to sort of try to understand here,
convoluted,
right?
yeah.
But I'm thinking to myself, let's say you have a regular dentist, someone you see from time to time, even perhaps if it's not as often as you should.
Right.
This law kicks in. Can you go back to your own dentist and say, hey, I understand I now qualify to get free or whatever percentage dental work done here, and I would like you to do it? What if your dentist has decided not to opt in?
That's the dentist's choice. The dentist can decide if he or she wants to be part of the program or not.
Okay, so there's no guarantee of any kind.
There's no guarantee
Okay.
that way at all.
Okay, I'm seeing it as like when you have a workplace injury, and sometimes some people will see you, and some people will opt not to see it. So it'll function a little bit like that. It sounds.
I guess so. And you got to remember that there's other aspects of dentistry which are very important in my eyes. For instance, implants are not going to be covered because that's an advanced procedure. Even though I always kind of say if you break your hip, you get a hip implant. But if you lose all your teeth and you're an oral cripple, you're not entitled to implants. That's another case for discussion.
So we don't, like you said, some stuff is going to be covered and some won't. Why? I mean, maybe you could just speak for a moment, Dr. Wiseman, about the importance of oral health and what an indicator it is, why people should be sure to see a dentist.
Well, first of all, we do know that there are links between poor oral health, and diseases such as cardiovascular disease, Alzheimer's disease, diabetes. There are all these cross links together. And the effect of the inflammation that goes to the brain, to your heart, to your kidneys, these are all factors that could be corrected with good oral care.
Okay.
We have to wrap up. I'm just wondering, it's kind of an obvious question. Do you think, given this now, whatever percentage of the population couldn't take good care of their teeth before, are you expecting to see a surge here?
I certainly hope so. I really hope that the Quebec oral health will improve, especially for those over 80. And this is the group that's probably more at risk of diseases because of that age group.
Okay.
Well,
Look,
that explains that age.
this
then,
is just a
87.
matter of weeks, I guess, before this is implemented. At
Well,
least,
you know,
right?
it's funny you say that, Aaron. It's actually only going to start in May or June.
Oh.
They're rolling it in slowly because there's a lot of applications. So it's going to start, yes, very soon. They say December for those over 87, all the way up to March for those who are 70. And it's slowly you're going to allow to enroll these people. They're going to receive a letter from the government based on their income tax returns,
Oh, I
whether
see.
they're
Okay.
eligible.
Oh, interesting.
Okay. Well, I imagine you'll be getting, even though that's not happening today or tomorrow, you're about to start getting a lot of phone calls from people who only look at a headline and go, hey, I understand dental care is going to be free.
Yeah, I've
good
gained
luck with
those
that.
calls already.
Dr. Yeah, I'm sure. Thank you so
luck.
much. Appreciate your time today.
Thank you, guys.
You bet.